Well, good morning. Good morning. And welcome to this important conversation around enhanced premium tax credits. And being a summertime for these kind of meetings is always difficult to get everybody in an early morning, but I appreciate you all making the effort. This is an extremely important conversation that, again, not just what we'll do here this morning, but getting the word out over the next few weeks of this conversation. As you know, there's changes coming to the individual marketplace health insurance programs and those that are covered by it, and we're concerned because of the potential impact on the business community here in our region, but also throughout the Commonwealth of Virginia. I'm Brian Anderson, President and CEO of ChamberRVA, and we're glad this morning we could have this conversation with you all, but also we're going to use this recording to help everybody learn over the next few weeks about the changes that are coming. Before we start, let me thank the MCV Foundation for hosting us today. This is a beautiful space. So Brian and your team here at MCV, thank you for having us. I also want to welcome Senator Ghazala Hazmi for joining us today. It's always important to have our elected officials in on these conversations, and she certainly stays very in tune to the issues facing us, so thank you for being here this morning. Here in Richmond, we're proud that we have a very diverse and growing community, strong businesses, a strong economy. We also have a very strong healthcare sector, and that's something we're very proud and fortunate to have. It supports our vibrant economy here in the Commonwealth, but also in the capital region. But that strength will depend on the access to good health care, continuing, having the opportunity and affordable coverage for that health care access. And that's why today's conversation is so important. So we're going to talk a good bit this morning about enhanced premium tax credits. EPTCs, they're set to expire at the end of this year because of changes at the federal level. These changes will happen unless Congress takes action before the end of the year. And this policy of the marketplace has helped millions of Americans afford quality health insurance for small businesses, individuals, contract employees, and others. And so letting these tax credits lapse will have a very serious consequence for those individuals, those businesses, and our region. So before we get to the panel, we're going to show a quick video to give a little bit of grounding for this conversation.
Millions of Americans rely on enhanced premium tax credits to afford health coverage. In 2024, these tax credits helped 24 million people get coverage, keeping health care accessible for working families, small businesses, and more. But these tax credits will expire in 2025 unless Congress acts. If they're allowed to expire, millions of Americans will face a tough choice: pay much higher premiums or go uninsured. Without coverage, many will delay care until emergencies, leading to overcrowded ERs and higher costs for everyone. The economic impact will be severe. But we can stop this crisis. Congress must act now. Tell Congress to extend the enhanced premium tax credits.
So to help us kind of unwind this conversation this morning, we've got an interesting, a talented and interesting panel of experts. Let me introduce them to you so we can get started. Michael Elliott, Chief Operating Officer for VCU Health System. Ron Carey, Founder and CEO of Tilt Creative and Production, a creative advertising agency and full-service production company in Richmond. And Lance Jones, Chief Executive Officer of Chippenham and Johnston-Willis Hospitals. Please join me in welcoming them to the stage. Well, good morning.
Good luck with getting back out of this chair.
These are comfortable. These are comfortable. Well, thank you all for being here this morning, more importantly, for caring about this issue and being willing to help us educate as many people as possible so we can advocate as much as we need to with all the different players to help us with this. So let's start. The EPTCs have helped nearly 350,000 Virginians access health care coverage through the marketplace. And from your perspective, let's all take this one. Why is access to affordable health care such a critical issue, not just today, but in the recent future, as we've talked about this a whole lot from the marketplace perspective?
Did you want to start?
It's like everybody waiting
Just
on this
open.
first one.
You mentioned that I'm a business owner. I think it's absolutely critical. It's kind of the underpinning for kind of how our society works across the country, but most certainly across Virginia. And as a business owner and entrepreneur, if you can't have a basic thing in place like healthcare, it's really challenging to run a business. So I think it's absolutely critical, and I think this particular issue is very underestimated at this point and could be the tsunami that's heading toward us coming on shore if we don't get in front of it.
Yeah, Brian, firstly, I think the reality is that this has arguably been sheltered a little in terms of the public discussion because there's been such a focus on Medicaid. And as we've seen the One Big Beautiful Bill Act move forward, all of a sudden, as much as there's been an effort and a realization that the expiration is upon us, we're 90 days out from open enrollment. And I think for our audience and for those that are listening, understanding that as folks that have accessed the marketplace for insurance, small businesses, gig workers, private businesses, that open enrollment period as it comes upon them, all of a sudden is going to be very material, and they're going to be faced with what I'll call the sticker shock. Mm-hmm. And we'll certainly share some numbers between all of us this morning. The sticker shock to their premium is going to face them with a decision. Do I re-enroll? Do I not? What does that mean for my family, for my partner, or whatever it may be? And all of a sudden, if we're in a situation where folks decide to not re-enroll, they are still going to get sick. The health needs are going to continue, and unfortunately, it's going to be an additional burden on emergency rooms, urgent care clinics, all of those access points that we know we've dealt with before and frankly are already stressed across the nation.
Yeah, Brian, I think you're going to hear a constant refrain, and it's based on things that we already know as to be fact. When premiums go up, people have to make decisions about what they put their money towards. Many times people are choosing between the premiums, health care, food to put on the table, sending their children to school, etc. And when that happens, we know people oftentimes choose the things that are more immediate and in front of them. When that happens and people deny themselves of the ability to get access to preventative care, all the things you just heard happen. Emergency departments get busier. People skip preventative services that could prevent them from getting into dire situations. And we know this, and so anything that we can do to make sure that we keep access to coverage is one of the first things we need to make sure we do and stay consistent with for better health for everyone down the long term.
As we've talked about this the last couple of weeks, it seems to me we've had expansion of Medicaid throughout many states. Federal government's been a part of that as a partner. We've had the marketplace come into effect, which gave a lot of small businesses and other people who didn't have access before access. And that seemed like this was kind of slipped under the radar, but it could be another major disruption. Am I building this too much? Or is that?
You're correct. And again, if you look at the Medicaid rolls across the country, obviously there's a number of folks that are covered with Medicaid, very broadly. If we drill this down to the enhanced premium tax credits, just looking at the state of Virginia, you've got 350,000 people right now that have enrolled into the 2025 current calendar year that could be impacted. And to give maybe some examples might help in terms of putting this in perspective, because I think Michael's absolutely right. If you're right now a married couple or a partnership couple over the age of 60, and you come up to a re-enrollment time period, you will expect an annual increase in your premiums of about $12,000 per year. So it's another $1,000 per month in regard to the increased premium that has been previously a credit. So when they've gone to the marketplace enrollment site, and obviously this is based on household income rates and it ranges up to 400% of federal poverty level. But when you've gone to the open enrollment marketplace, the actual credit is not seen on the enrollment screen. So you as a consumer, us as a consumer, a small business as a consumer with 10 employees that are looking to make their decision come October for next year's plan, had not historically seen what that price was. And my premium was $400 to cover myself and my wife or partner. It's $500 depending on my health condition, etc. Now it's $1,500. And all of a sudden, to Michael's point, well, we're faced with this with rent and food and gas and other demands that are on life. That's the part, because it's being arguably, not necessarily sheltered, I don't think, Brian. It's just we haven't arrived at open enrollment time, so it hasn't been dead center for folks that are truly going to be impacted by it.
So Michael, at VCU Health, I think you sit in a unique position that you see both the clinical and the operational side of this issue. When policy shifts like this happen, like EPTC expiration, walk us through how just the loss of a tax credit might affect patient care delivery, or even more. And you've touched on a little bit, but go a little deeper on even the delay in treatment because of the financial strain.
Yeah. So let's just walk through it stepwise. So we've already talked a little bit about the decisions that families have to make, absolutely. But let's talk about someone. We'll call him Joe. Joe has 3 children. Joe is self-employed and does pretty well, but lots of expenses in his business and in life have started to go up. If this happens to go through and he's getting through the individual market, his coverage for himself and his family, some of the numbers that Lance just described that are eye-popping, he's going to have to make some decisions with. And let's say that Joe decides, because he's trying to care for his family, send them to school, and other items. Let's say Joe says, you know what, going from $500 a month to $1,500 is just not something we can do right now. We're all in pretty good shape as a family, so we're going to forego this and hope that nothing happens. And so I think we've all learned that hope is not a strategy. But Joe's children are active, and they're athletes, and things happen at times when you're athletes. And so what we could see in that scenario is that they end up needing emergency services. They end up in the emergency room, and there's some pretty big bills that come along with that. Maybe the children needs an MRI because of an injury, a sports-related injury or something like those. And now the problem for Joe and his family has compounded because of those particular items. But let's go a little bit further. So Joe, pretty well shaped. He's kept in shape running after the kids. But we know at middle age, as we start looking at some of our other comorbidities, a little bit of belly fat starts to come in a little bit. Sit in. Anybody else have that issue?
It's getting kind of
Is it just
personal,
me?
Michael.
Is it just me? But those are signs that our bodies are changing, and we have to do lots of preventative items and able to keep ourselves healthy. So preventative screenings, whether it's colon cancer, et cetera. We need to do things like that. Joe puts that off, and so does his wife. We might look at some other items. Hypertension starts to creep up in prevalence as we get a little older as well. It's called the silent killer for a reason. You have to stay on top of it, or you won't feel the effects sometimes until you've had a acute cardiac event. So I just use those because when we start talking about facts and figures, it can be very impersonal. But no, I just talked about Joe, and Joe is real. Joe is some of you and I and his family as well. So the impacts that occur are not only clinical and real, but they are financial as well. Just from a business perspective, if you have uninsured patients that you take care of, and we're proud to take care of, you usually don't collect very much at all from those services. So they're being done essentially for free as well. So what does that do? That actually raises the prices for others who do have commercial insurance to help offset some of those costs. So it all really works together.
I love the way you made that more personal for us to think about, the family specific. But you also referenced something that we need to make sure we clarify. This is not something. This particular tax credit will expire. I mean, it's set in policy to go away. It has to be reenacted. And if you all know what's happening at the federal level, getting anything approved is getting harder. So just be aware it's not something that might go away. It's scheduled to go away. We got to make sure we get the message out that we want. And we hope you hear today that we all have a role in trying to get that to our Congress and senators, congressional members and senators, that they have to reenact this. Ron, your company offers health insurance to your full-time employees, your small business, but you also work with a lot of contract employees and freelancers. How do you envision this affecting them, given the role they play in your work?
Yeah, first of all, I mean, I feel so fortunate that we're in a position to be able to provide benefits. Many small businesses aren't in a position, as Brian knows, running things at the Chamber, aren't in a position to be able to provide health care to their employees. So first of all, appreciative of that. When I think about our freelance workforce, we're very fortunate, they're fortunate, thankful that many of them have found health care options. But let's think about Michael talks about personalizing things. Across the state of Virginia, we've got about 78,000 small businesses. And think about who does your shoe repair. Think about who does your lawn care. Think about all those services. If those folks, and most of those don't provide health care, right? They're smaller than $1 million a year. They've got 5 to 10 employees. They're finding a way to get by and to be in business. And quite frankly, one of your largest expenses is health care. But to me, it's been one of those things that's really important. So when I think about kind of our freelance pool, and I think about the state of Virginia, which is a very large film industry, without the ability for freelance workers to get, in gig economy workers to have health care, many of those folks would have to make different life decisions in terms of what, could I work in the film industry? Could I work as a freelance writer? Could I work as a freelance photographer, videographer, you name it? But those are really vibrant things for our communities. And when I think about those other industries, it's quite clear that some of those industries would not exist, and those folks would not have the ability to be an entrepreneur and be in business if their folks didn't have health care coverage. So I think it's quite significant. And if we don't figure it out, I think we could have a number of that 78,000 across the state of Virginia that won't be in business because they won't have the workers to do the job.
So we're already in a talent crunch.
Talent.
We're struggling already. How does that? So what happens to your business when you have another 10%, 20%, or 30% who can't do the work you need? How does it affect your work?
Yeah, I think quite frankly, it starts to it slows things down significantly. We're very interesting in that a lot of the work we do, some of it's in Virginia, but a lot of it is across the nation. And so, quite frankly, it forces me to make different decisions in terms of the talent. Maybe even having to expand my workforce in terms of what's full-time versus what's freelance. And so that's certainly got an implication to it. And just so that you understand, when you think about, my guess is most folks in the room have benefits. When you think about it, most employers are covering somewhere between 50 and 70% of the cost of those benefits. So when you talk about a credit, that's super important to the folks that don't receive it. In our case, the employer, we are providing that credit. So we cover about 72% of the cost of those benefits. So by the time it shows up for what our employees pay out of pocket, it's been significantly reduced. But it forces us, Brian, to drive a very different set of decisions in terms of opportunities and will we have those resources available to us, if these changes were to go through.
Lance, Michael did a good job of talking about some changes that a hospital administrator has to look at. But as the CEO of a health system, and you start looking at departmental changes and how your business will change depending on who's accessing what, just talk a little more about the change in emergency room usage and how that proliferates throughout the system when that change happens.
Yeah, Michael gave a great example. So if we continue, let's continue the story of Joe and the family. We saw this post-COVID, and folks took a response to COVID with a fear of catching at something that they made a conscious decision to avoid being around other people. They delayed tests, they chose not to go through screenings, etc. And as we came out of the COVID challenge, all of a sudden, health conditions that had been not as present or not as significant during that time period, all of a sudden started to rear themselves. And cancer, frankly, was probably the most prevalent. Folks put off screenings, didn't get mammograms, didn't get colonoscopies, etc. And we saw an incidence rate where things accelerated. Folks with joint replacements said, we're going to put it off because I don't want to catch COVID, if I came to an institution. This is, in essence, something very, very similar. The difference this time is the COVID aspect is the premium increase. And what that will invariably mean for departments within the hospital, and quite honestly, it's really going to be the emergency department that will be most significantly impacted to every hospital across the country, is folks are going to turn up in truly emergent conditions. They've put it off They've waited as long as they can because I know if I go to the hospital, if I go to an urgent care clinic, I'm going to receive a bill and I can't afford to pay for it because of the other demands of what Joe has with the family. So let's see if we can manage this at home. It's over the counter, it's CVS management, etc. Sooner or later, they reach a point where now it's truly emergent. And all of a sudden now, the overrun emergency rooms that honestly are already crowded, and it's already difficult to manage just the clinical elements will become more stressed. The other element that I'd just like to share with too, Brian, as we talk about this is just thinking through, I shared the example of a 60-year-old couple earlier with a $12,000 premium increase. If we look at Joe's family, and let's just hypothetically say Joe's family's making $124,000 with his 2 children and wife here, they're looking at a $4,500 premium increase. And I think this is the part that really does hit the small businesses element of it, that all of a sudden it's the body shop worker, and it's the gig worker, and it's the small restaurant owner, etc. But the reality is, if you look at a family of 4 and the 400 times federal poverty level takes us up to about $130,000 right now. An additional $4,500 of real income on a premium is clearly going to have them finding that decision juncture. Do I re-enroll this year? And I think Michael is absolutely right. I'm going to take hope as the opportunity here. I hope we don't get sick next year. And let's look at the following year to re-enroll. Again, that creates crises then in organizations. Franklin Memorial Hospital, so a hospital in Southwest Virginia, have already made some announcements in terms of some of their moves relative to services. We're seeing that with Medicaid already across the country with particularly obstetrical services, hospitals that have managed an obstetrical program which is run 24 hours a day, staffed 24 hours a day, are closing them. And mums are having to drive further in some more rural markets right now, but the reality is all services are going to be impacted in some form or fashion.
Are either of you seeing in your emergency departments already some of that access rate go up?
We definitely see more folks accessing our emergency rooms and using them more as primary care. I think it's truly multifactorial for us as to why. This situation hasn't impacted us yet because obviously, as you said, the expiration of these credits hasn't impacted somebody's decision yet for the current enrolled year. It'll be next year.
So thinking about, if we look at cost of living, our region versus other places in the country, just for anybody who wants to weigh in, are we a little bit more vulnerable than maybe those south of us who cost of living is already a little bit of an advantage for them? I mean, our housing's, mid-tier, just the cost of living of being on the eastern seaboard. Is this going to just weigh into that from a competitive standpoint for our region?
My take on that would be, I think, all of us have a budget, right? And when a significant percentage of your budget is impacted, I think whether you're in a lower cost market, a mid-cost market, or higher, I think across the board that pain is going to just feel significant, regardless. But when you start talking anywhere between a 40 and a 200% increase. One of the things, Brian, you often talk about at the Chamber is, vibrant communities and building vibrant communities. Well, if your tax base is impacted, if you've got people showing up to get healthcare treatment, and they're going to, let's be honest, they're going to show up regardless of whether they have coverage or not. And then now some of those folks may face financial hardship in terms of bankruptcy and how do they pay for things. That starts to drag on a vibrant economy. It starts to reduce the tax base. So I think the implications, right, there's the healthcare implication, and then there's the socioeconomic impact of how do you create a vibrant community. And I think this significantly prohibits folks from being able to invest, plan for their future, buy homes, do all of those really important things.
I didn't ask it as well as you answered it, but that's the concern. Is a region that we're trying to compete with other parts of the country. You need every piece of that fabric to be as competitive as possible.
Mm-hmm.
If we've already, we've got a housing cost factor concern, like everybody in the country, but ours can be a little bit higher because of the type of region we are. Add to it, I've got another $1,000 a month I got to cover. It just exacerbates the continued concerns about where can I live, where can I work and thrive. Yeah. So if you all had to tell our audience and those that will hopefully watch the video or the recording as we go forward in this conversation, what's one message you'd like people to hear? I mean, tax credits certainly aren't something we all walk around talking about every day, but this is pretty significant in that it really can drive costs up when we don't need costs to go up any more than they already have. What would you tell our audience and anybody that could weigh in on this? What would you tell them to do, one message, to help us get this message to our congressional leaders to rethink the credits?
For me, I think I would pick up on Michael's notion of before, which is personalize it. I think there's at least one party in your life that likely is benefiting from receiving a credit to get their health care. Think about who that person is and use that as the impetus for then reaching out to your representative, whether at a state level or a federal level, to say, we need to be able to help kind of our neighbors. And here's who Joe is and what Joe looks like, and the challenges that Joe's going to face if we don't do something.
Yeah, I would share. I think your point at the beginning, Brian, is really critical, that these tax credits are up to expire at the end of the year. They go away. So if something is not done this year, then many families are going to be faced with a significant challenge. The call to action is specifically contacting our elected officials, and there is certainly very good information available. KeepAmericansCovered.org is a very good site that you can actually break it down by district in each state across America relative to what the impact would be in terms of the number of individuals and population impacted. But I think it's a very clear call to action, and we're 90 days out from open enrollment starting again in the country. Folks need to take some action very quickly. We lost the opportunity with one big beautiful bill, and we were optimistic that something could be a part of that, but that opportunity's gone. So there's got to be another moving vehicle to attach some kind of legislation to that allows for the preservation of it, and that's going to take all of us raising our voice.
All right. Is there anybody named Joe in here today? Joe is real. Joe and his family are real. So making it real makes a difference as well as we advocate. The only other thing I would add to what's already been said, being a pharmacist, I have to tell you, I've been over my career able to see people put off health care. And I used the analogy of high blood pressure before, but this situation is like having high blood pressure. You might have a symptom here, a symptom there, but it's not constant. So right now we're talking about what could happen. And so if these expire at the end of the year, there may not be a critical event right then and there, but over time, your body, in this instance, this is our community, will get stressed and will get weaker. And at some point you're gonna look up and say, how did we get here? How did we get to a place where our system is so messed up and not working appropriately? So just because there aren't acute issues that we're feeling right now, we still have to pay attention to it right now.
I appreciate, Michael, you again personalize it with somebody we can think about and see. I just add that the ALICE data that you can get through the United Way across, it's a national set of metrics. We've looked at it here in the region, and somewhere between 50 and 60% of all employed people in our region would qualify, what you described so well, that any amount outside the normal budget, another $500, another $1,000, will become critical. They will not. They will have to make decisions about, can they fix the flat tire? Can they send their child to school? Can they afford the medical bill that they weren't expecting? So, and we all have to humanize this as best we can. So as you all do start talking to your elected officials and anybody else we can get to weigh in, we've got to make this about families and people, and not just some government mechanism that can get really lost in the shuffle. Just a few other statistics. Lance did a great job of outlining many of those specific to the healthcare system, but we want a thriving economy, whether it be the U.S. economy or the Virginia economy, and just thinking about this type of expiration could cause anywhere from 285 to 300,000 jobs lost. We need more jobs, not less. It can cause GDP in the country to drop by $34 billion. Just in Virginia, it's 2,000 jobs could immediately be dropped because of the expiration. Our GDP can decline by $250 million. So these are real numbers. This isn't some fictional, fault that could happen. We need to be very aware of the data and, more importantly, the people that this can affect. Thank you all. That was wonderful to set all of this up. I want to make sure we can also allow our guests this morning to ask any questions, make any comments, so that we can continue this, this information gathering and discussion. Questions? Don't be shy. Yes, ma'am. I'm sorry.
Thank you. You've talked a lot about people that are older and that are maybe, benefiting from health insurance through their partner, but a lot of younger people aren't getting married until they're much older, and even almost like 50% of women are expected to be single and single mothers. So what does that look like? That landscape look like?
So I don't have a number off the top of my head that I could give you in terms of just a single individual, but I'd throw it out. I've got a number of colleagues here as well that are all part of healthcare in terms of what the premium impact could be, but it's certainly all going to be referenced based on income level, up to 400% of the poverty level relative to your credit that you will receive. But the reality is without the tax credits being preserved or renewed, the reality is there'll be a premium increase. That part of it's going to be inevitable, but I couldn't tell you the number.
I can't give you a specific number on that. What I can say is my biggest concern, this has been a passion for me since getting involved in it, is when you start to think about the implications of, healthcare works really on a pool. It's like anything else, and you want healthy people in the pool. You know that there are going to be some folks that are unhealthy in the pool. You want that pool to be large and wide and people paying into it and vibrant and flexible and reflexive in how it survives. If it starts to be compromised, I like to think of it as, I don't like to, but I think of it as a Jenga thing. You start pulling out pieces, all of a sudden the whole thing starts to just crumble. And so when you start thinking about some of these young workers, male or female, and all of a sudden them saying, I'm going to get something through my employer, well, the employer pools are going to be impacted. The marketplace pools are going to be impacted. So it's just a significant ripple effect, and it really isn't if you will be impacted. It's just a matter of when you'll be impacted.
Yeah, I think that is an important point. The reality is if they're not preserved, this is now inflationary. So everybody else that's sharing in this pool is inevitably going to see their premiums increase as well because the risk tolerance is now, it's exposed. That's why, as we talk about this collectively in the healthcare industry, this is not a health policy, this is a business policy. Healthcare is going to be impacted, but this is a business preservation. These are our entrepreneurs that are out there saying, man, I can take a run at starting a new company, and I know I can hire 2 great tech workers, software designers, AI experts, and get it going, and they can roll in the exchange so they're getting a benefit. This is a business, this is a business policy that we're talking about.
Senator?
Well, thank you so much for the presentation, really helpful. I'm just curious what the conversations have been like with our federal electeds, and have there been opportunities for sitting down and having these discussions and laying out the directive? I took a look at the website, and
Yeah.
I see my congressional district represented by Jennifer McClellan is going to be pretty significantly impacted.
Yeah.
What have those discussions been like? And then secondly, how can state level officials help in highlighting the concerns with our federal congressional reps and making sure that they understand the severity of the crisis that's facing us?
Yeah, and again, sorry, go ahead. There have been a number of activities I can just share with you specifically from our company on the HCA side, and then you look at the Hospital Health Association in terms of the state of Virginia, but very, very active campaigns, including all of our associates, board members, from a letter writing and notification, and then a number of us actually traveled to DC, had an opportunity with representatives and senators alike in terms of discussions with them and the impact to their district. So they are definitely well aware of the exposure. There's no one that could say, oh, I haven't heard about this or wasn't aware. They'd be fibbing. So you'd let them know that we've had a chance to share with them what the significant impact is going to be and what we need them to do. They need to step up and take action in regards to preserving this and finding some other moving vehicle that some legislation could be attached to.
I would agree. Just to add on to what Lance has said, there's different levels of advocacy, obviously, as well. Our individual organizations, state organizations like Virginia Hospital and Healthcare Association, the American Hospital Association, America's Essential Hospitals. Everyone's singing from the same sheet of music right now. So I think awareness is there and growing by all means. And from a receptivity standpoint, I think everyone's listening But as you very well know, there comes decision time as well. And so we're going to have to keep up the communication, continue to make it personal as well. But I think we're up for it.
Others? What? Well, I would add on to that, that unfortunately not is enough in the business community, at least what my research is the last month, working with Lance and others. I think there's so much oxygen was taken out of the big beautiful bill, the tax side of things, which there's a lot of conversation about that. There's, you know, I think Lance and some other conversations we had, you know, if you're going to benefit from the tax system as a family of four, say of $2,000 more that you're going to get back on your federal taxes, but your medical premiums go up $4,000, you're now in even worse shape. So we've got to make the case now that we've got a period. We missed it in the big beautiful bill. There's some others that I thought would be advocating that aren't, so we're raising that conversation with them. We've got 3 months, and I think as people start getting their premiums, their quotes for this year's coverage in the next couple of weeks, maybe month, there are going to be a lot of phone calls, and so maybe this can be the spur to get some federal action that I think right now they've been a little complacent in some parts, so we got some work to do.
Brian, I would just add, I mean, you know, we all keep saying it, the patient, the sick person is going to continue to show up. It's not an if, they will show up. And I know, you know, we're fortunate in Virginia to have a rainy day fund and have some added resources. But when you think about the level of impact that this could have, we could start cutting into that rainy day fund significantly as we move forward. And we're a state that's in a healthier position. There are going to be certainly states that are not nearly as healthy and having the resources to pull back on, to draw from. So I think that is a significant thing to keep in mind.
Ron, I'll just add, I want to add on to that. There is a stacking effect of what's happening as well. So we're focused on this particular item, but it is one of many through the Budget Reconciliation Act that is going to continue to put pressure on families, but also the healthcare system to be able to provide services. So as we talk about these individual topics and go deep, we also need to go wide and look at the stacking effect of impacts across the board.
Absolutely. Well, good point. I'd ask, Senator, can you add any guidance to us about how we can most effectively, and so people interact with you, what would you give our audience that's going to be listening, how they can do a better job of impact of communicating with our elected officials?
Thank you so much, and I think the point that was just made of the stacking effect is significant. I was thinking, I agree, this is a business-related crisis, but it is really a healthcare crisis as well. And when we're thinking about the perfect storm that's being created on our health and hospital systems with the impacts on Medicaid and the loss of services, especially immediately in our rural hospital system, but now the ripple effect that we're seeing, it is a perfect storm that is going to impact every sector of our economy as well as our communities. And I think for me, sitting here listening, and when we talk about the levels of advocacy, one thing that we're going to take back is to share with our fellow colleagues about the issues, help them to engage in a strong advocacy program, to reach out to our individual congressional representatives and our senators and make sure that they hear from our offices as well, because it's impacting Joe, who lives down the road from me, I know, and we need to make sure that we do humanize the situation and that they recognize the crisis that's coming. So I think that's so important that we engage all of us who are in the General Assembly in this discussion.
Yeah, volume matters, quantity matters. We have to all communicate, because if those in those positions only hear from a few, it's easy to ignore with all the other issues on their plates. We've got to make sure we're calling and writing regularly. I see another hand. Follow up.
Just to clarify, are there any differences as far as the path forward for nonprofit employers versus LLC employers?
No, in terms of the enrollment process on the marketplace, everyone will be treated the same.
I will mention there is in Virginia, specifically Virginia, there is for any employer of 49 employees or less, even the marketplace is one place you can go. There's also a wise choice benefit that our General Assembly gave us the ability to offer 2 years ago. It's still growing, so if you're a small business that fits that 2 to 49 employees, call us at the chamber. We're happy to help you. It basically means you can decide if your employees can get a different rating rather than just the marketplace. So not to get into all the details now, but please ask us if you have questions. It could help, not just in relation to the EPTCs, but more importantly, just in how you can cover your employees differently. So again, Wise Choice Benefit Health Plans, just give us a call. We can help you with that. Any others? Yes, ma'am. I'm sorry. Yes.
I hope you'll forgive me, I'm not a chamber member, but
It's
I'm
okay.
curious to know whether, particularly the health executives, health system executives, have had to do any thinking yet about how pricing or services would have to change with the breaking expires. Is there anything concrete on that front yet?
I'd say nothing concrete. We're always doing contingency planning, for sure, so nothing's changed from that front. But once again, this is a time frame in which there are a lot of things starting to stack up, and so our planning is getting much deeper. Frankly, hopefully that won't lead to actions and decreased services, but I imagine in some places, if some of these things happen, it could.
A very similar answer to Michael in that regard, thinking about it, you know, options and what we could be faced with. But if you certainly look across the country right now and see some very large systems that are responding fairly aggressively, and most of it has been on the labor front at this point. But I think it's going to be inevitable sooner or later. Certain services, the consolidation of services, et cetera, the reduction, the elimination, as my example was Southwest Virginia, that's going to be material.
Could we see anything in Metro Richmond, like a drop in the OBGYN service or a mental health ward, that kind of thing?
I think, honestly, it's always going to be an assessment and an understanding of what ends up occurring or not occurring. But I certainly would say, you know, at this point, you know, everything's going to be looked at. You know, it has to be looked at, and you've got research components in our hospitals. Certainly the service side, you've got the supply side chain challenges that have happened both offshore and onshore. You've got the tariff impacts that are out there. So there are a multitude of factors that are weighing on healthcare organizations that already ran a margin of around 2% and have done well on that. You know, this kind of impact here it's significant.
I would just add, we're fortunate to be in a good-sized region that is fortunate to have wonderful healthcare systems. I would look at our smaller, more rural markets that I think if services will be cut, you could have hospitals literally in that level where they can be solvent or not. So we need to look at this across the state and say, because I don't want Southwest Virginia or even other parts of the country lose their hospital coverage because of something that we can fix, we can control.
Brian, I just want to add just
Yes.
briefly onto that. It's one thing talking about the hospitals. At the end of the day, we need to think about the people in the hospitals relative to those doing the work. And I'll just talk for a minute about our physicians. The significant number of physicians across the state and honestly across the country are small businesses. Their staff enroll on the marketplace. They are going to be faced and know that they're going to have these same challenges as well. So you've almost got this double-edged sword. The providers trying to do the work and take care of the people while they're seeing their benefit programs impacted as small businesses as well.
My question is more kind of just a curiosity about bigger picture with healthcare. So, like with something like this, with the expiring tax credits, or you know the decreased coverage of like Medicaid, Medicare, feels kind of like we're all in just kind of survival mode, and it feels, I think, like you said, maybe you know, as time goes on, we'll feel the stress of you know of the broken system, and I feel like it's kind of always been broken and unaffordable as you know people struggle with medical debt and everything like that. So I guess I'm curious, if we're constantly dealing with the survival mode of putting you know tape over the holes that water's coming out, trying to like just get people coverage, even if it's still like you can still have coverage and still have something denied, you know, or even with the cap on loans now that through the act, so we'll see less people go to medical school, be able to go to medical school, decrease in physicians. I guess my question to you guys is, in the circles and conversations that you're in and your own experiences, where do you see kind of
Lance and I are going to take care of that.
You speak for yourself.
Put your capes on.
It's a really good existential question at a large scale. I like to always think healthcare is local as well. So some solutions for some areas may not work for others. And so it's a very dynamic situation. And so while there are some really, really large scale things, and once you start looking nationally, sometimes it can get really, really big and really, really tough to start figuring out how you make things locally happen. So I many times like to start from the grassroots of the communities that we're in, take the uniqueness of each community and figure out pathways to take things that way. But also, yes, it's good to look at national items and be able to push from that end. And hopefully we're making it come closer together from that perspective. But I would agree with you, significant challenges, but also significant opportunities. Been in healthcare over 25 years now. And one of the things that I know for sure is the ingenuity and the passion with which everyone who comes in every day has. And so we're going to need that. We're going to need to support that and make sure that that's a part of what we are and how we do things moving forward, especially in times like now.
I think great question. I think that we have to think sometime about not, is it just the one piece of the policy, but how do we holistically look at the things that are important? And we can choose what level car we drive or what type of house we live in some cases. You can't choose medical care. You either have medical issues or you don't. And we're great that we have wonderful systems who can take care of us. But they're going to make healthcare decisions about how to run their systems to do the best with what they have to work with. This is a business issue. This is an employment issue. This is a family issue. So how do we do what you articulated so well in your question of look at this different than just one little piece of the code. So I think as we talk to our elected officials, we need to make that case that, listen, we want a system we can depend on, a system that's high quality, a system that's open to everyone, and we can pay for it. So if we can do that, I think we'll be in a much better place. Just a quick reminder, these credits will expire. They're due to go away December 31st. So we've got a few months to do our job to try to get Congress to do what it doesn't always do great, but to take immediate action. Don't just wait on this. Listen to everyone and get into the game of how we can build the system you described so well. Our healthcare partners are here today to help us articulate what it's going to mean to all of us when we go to our doctor or have to go to the hospital. But this is, again, about families. It's about businesses. It's about the economy and how we can take care of each other. So let's keep that perspective as we go forward as well. Thank you all for not just being here today, but really your expertise in articulating this one issue, but more importantly, the healthcare issue at large. We've heard clearly today about the tax credits, the enhanced premium tax credits. They're more than premiums. They're about people, stability, and access. But we want you to be able to take action. So in addition to picking up the phone and the email, we've got some QR codes I think we're going to show, or we're not going to show them? Okay. We'll have that for you. If you don't have that ability as far as today, call us. Let us know, both our healthcare partners as well as there's some pamphlets in the room. Take those, but more importantly, don't just take the information when you leave here today. Let's all make a call and an email because the elected officials do listen to numbers to help us get to this point. Anything final, panelists? Time to go to work, right?
Yeah.
Thank you all for being here today. This recording will be available. We'll all can put it on our websites. You can do the same thing. Let us know how you can be a part of the conversation. Enjoy the rest of your day, and thanks for being here.
Thanks.